I'm starting again. It's during the weekend
Yes.
and during the weekday, not at, okay? This decision action, it's 2 words, decision. It's either this decision or this action, okay? The student disagrees with this. They're in the middle of winter for this reason, maybe. Okay, so I would have liked to have heard you outline the suggestions. A few suggestions were offered, or there were some suggestions that we could do this, and then we could do that. Okay. Let's see this one. $25 to add a $25. Wait a minute. To add a $25. Okay, it's without the S. To add a $25 increase. That's fine. In the fees for the students. Now, when you say the second reason, $25, it would be with an S. $25. So when you get to the first one, maybe we could say, my first reason is blah, blah. Out of dated, it's out of date, okay? For the second reason, that's like you're starting a new sentence. So the sentence would not start with for. It would be the second reason, or my final reason, or the other reason. $25. Okay, $25 is affordable since, not as people, but since people. Okay, I think I'm detecting a little more Oz than normal. So just,
Because it's life.
I'm sorry.
Because I did it almost for the first time or the second time without rehearsal.
Okay, and that's fine. That's fine. But you know that you're going to have to practice because you only get that one time to do it at the TOEFL
Yes.
test. Okay. Okay. So even though you may feel that, I guess you're coming home from work and you feel like, oh my gosh, I got to submit something because I asked, which is fine. You do need to submit something, but throughout the day, while you're at work, when you go to the bathroom, we're talking about 1 minute. You want to start saying these things and practicing these things. All right. I think those were the two that I asked you to do. Is that right?
Yes.
But I asked you to go through the entire thing, like the entire part one, part two, part three, where you're actually listening to the two people talking.
Yes.
Did you do that?
No, I do just one exercise number 2.
Okay.
Uh,
So
Reading and 2 people talking only.
okay, is this the one? Have I listened to it yet? Shady, is there another one here for me?
No.
Okay, so which one of these is where the two people are talking?
Both.
Okay, so you don't
Yeah.
point out
Yes.
to me. You don't really point out to me who's talking. You don't point
No.
out. Okay, well
40.
you'll need to point out even in your speaking who's talking.
Yes.
And in my opinion, you should have 6 recordings. That was what I was asking, but I'll come back to you. Okay, so let's see. Nabila, which one is this? Nabila?
This is a task you gave me about the GERD patient.
What's wrong with the patient? Tell me.
He has a bitter taste in his mouth and some difficult swelling, and he is a smoker and
Okay.
consumption.
Okay, so up here somewhere, maybe you can tell me what it is that I'm looking for and listening to. All right, let me just take a listen to this. And the reason I had you do this, I wanted to see how you would even tell me what the diagnosis is without even knowing what the patient would say.
I am the treating physician today.
Okay, so that wasn't really what I was asking. So I'll listen at it again and tell you what I would want you to do. So that was Nabila.
You mean the task or the way?
The way that the explanation was not exactly, but we'll.
Hey, yabo.
Okay, thank you, Sarah, for that. And because this was not the task with the patient, it is just to tell me what the symptoms are. Shady, I'm going to give you something to do in just a moment, but let me go to. This is the book that we're looking at. I'm just going to quickly choose one. I'm going to choose. Okay, I'm going to choose this one. It's about a patient that has an episode of transient unilateral weakness. I have no idea what that is. I don't know what that is, but as the person that is preparing for this exam, you should know, I think, what this is about. So what I was looking for, I just want to hear how you talk about this type of problem, illness, or diagnosis. And it might sound something like this. Doesn't mean that this is true, because I don't know what would be truly right, but this task is to explain something about the thyroid function. I know that the thyroid function does this in the body. The purpose of the thyroid is to blah, 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 blah. Some people may have thyroid problems, and the best way to determine this is to have tests such as a glucose and cholesterol, blah, 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 blah. Oftentimes, a patient would be referred to have a CT or an ECG scan, and the purpose for having that CT or ECG scan, you would know what the answers would be. I don't. And then there are other things that we can do, or there are other things that can be done to rule out whatever was the problem, whatever the problem was. And that's it. That's why it should not take you more than 3 minutes to tell me.
I don't, Dr. Priscilla, I didn't get you. You want us to just prepare and finish the tasks, or I didn't?
No, I want to hear how, I want to hear how fluent you can just tell me what the cause is and what the treatment is. Okay. So it would sound something like, I don't know the answer, but I want to know if you know the answer, because if you don't know the answer, the biggest part of as I understood, the biggest part of your grade is going to be your understanding of what the procedure is. Okay. Not
You mean you want us to speak in medical? That's right. About the medical knowledge, particularly, not the communication, not the structure. Like,
exactly. Again, I'll do this one again. So I just want you to talk about, why does someone need a blood test? And it would sound something like this. One of the reasons we need to have a blood test is to determine the extent of the problem with your thyroid. And we can determine this by having tests. We can do a blood glucose and cholesterol test. We can check your creatine clearances. We can also refer the patient for a CT scan, which is for blah, 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 and an ECG, blah, blah, blah. And if I don't know, we could also tell the patient that we are trying to rule out TIA. A TIA is whatever, whatever, whatever. Because the patient may very well ask you those things. And I thought when I was putting together your activities today, I didn't know what answers would be here, and the blah, blah, blah seemed to be a little bit insufficient. So I'm going to give Shady something, no, I'm going to give the two of you something to do. And
Okay.
I'm going to work with Shady. I'm going to work with Shady live, or however. Let me find the activity for you and Nabila now. Here. I don't remember who gave me which question, but it doesn't really matter, because you still need to understand the format of answering. And so this one was, I think we did this one. What was this one? Blue. Did we do this one? 42-year-old person. I think we did that one. OET. I don't know why I didn't date them. Or maybe I did. Maybe they're right up there. Maybe they're right here. I think it's right here.
I think this is Futureland. Yes, that's.
Yeah, they are, but these are the ones that I created. I created these out of the book. This is the book. Copy. I didn't put them there. I don't know where I put them. Let me check. OET. GPD. Oh.
Doctor, what you are looking for?
You won't know. Some activities that I created today.
Okay.
I created them today, but it's not that. It's not that book. There were dialogues that I created based on what you sent me. I'll extend the class over. I don't have another class today. I just opened that one. Okay, there's one. Okay, we'll take a look at this one for now. I don't know what page it was, but this was about someone was a lawyer. Do you know who gave me that one?
Lawyer.
Or maybe I chose it myself. Either way, it doesn't matter. It may be that I chose it. So I'm going to, I'll just use this one as my example. I want to send this to you. Share. Link done. So, Sarah, what is your email address?
Yes, it's ARA.
Is this
Yes,
it?
that's yes.
Okay, and Nabila, is this yours?
Yeah.
Okay. Oops.
No, it's not Nabila.
So, this is not me.
N-A.
This one. Yeah. Nabila Dawood, yeah.
This one. Okay. And study material. Okay. All right. So what I want you to do when you get it, you are sending invitations. There's no, so you don't have a Google account. Share anyway. I hope that you'll be able to open it. And if you can't open it, I'll put it into the Facebook page. But here, I want both of you to practice both parts of this. So it doesn't matter to me who starts out to be the doctor. So hello, I'm Dr. Dawood. I am the attending physician today. How are you? And then you somehow wait for the patient. For just like 2 seconds. If the patient doesn't respond, then ask the patient for his or her name, and then you start again with, these things are always the same. These are always the same. If the doctor starts first on the day of the exam, of the real exam, if the doctor starts first, take this approach. hello, I'm Dr. whatever. And then you don't know who the patient is, but you just wait to see what the patient says for about 2 seconds. Then you go on and ask the patient to pronounce his or her name if they gave you the name already. And you say, yes, is this correct? Blah, blah, blah. Then every doctor's office that I have ever gone to, the doctor always has my chart. The chart is always in the door, so the doctor's going to have my chart in his hand, in his or her hand. Okay? So since you have my chart, you can say something that's in the chart. In this case, you could say that I noticed that you are a lawyer or whatever. Depending upon the card that you have, you may not know why the patient is even coming. So you have to be aware that sometimes you'll know, sometimes you don't know. But you should know something about the patient when the patient comes into the office, all right? Now we're down here, and if you see something in the chart, you confirm it with, this is the person's name. Empathy is built by using the patient's name. This is how you build empathy. Building empathy means using the patient's name. So then the patient say, yes, doctor, that is correct. And then we go on here. You want to constantly assure the patient when there is an objection to anything. I understand. I want to assure you. You can even repeat something that the patient has said so that the patient knows that you're listening to his or her condition. And then you get down to the end. Okay, does that make sense? Nabila, Sara?
Yes, it sounds like a template. We can
Yes.
give us the idea to arrange our organize our structure, and give us confidence when you have many times you read this, so it will give us confidence.
Yes. And this one was actually taken from your book. I just don't know which one it was, but this was taken from that book. But the structure is going to be the same. You're always starting out with, hello, I'm whatever. You're going to repeat what the one symptom is and then go on. But I'll also find the ones that I did for you as well. So are you able to go out now and do this in the Facebook group or no?
Actually, I can't open this, the email you send me. It is not open.
Okay, I might need to accept you. Let me see. Let me go out and see. Nope, it's not there. Let me go over here and go over here and see. Nope. All right, let me just go ahead and put it in the Facebook group.
Well, I have it, and maybe I can download it, so
but still
I can share it.
But she still needs to have it. You can try it. You can try it, but let me just go ahead and do it too. I'm going to stop sharing for a moment. Hey, Haas, how are you?
I'm fine, doctor. What about you?
I'm good. I'm good. You all can talk for a second. I'm trying to put something into the Facebook group.
Okay. Hey everyone.
Welcome.
Hi.
Thank you. How are you, everyone? How are you doing?
Good. We're good.
Yes, fine.
How is the session going?
Fine.
Right now, not going. We didn't start anything right now.
It is. It's always going. It's always going. You should always practice speaking. Just start to speak about something. It doesn't have to be about It doesn't have to be about this. You just need to practice, always practice speaking.
Okay.
So that you get the Oz out of your body. You can continue talking about anything. What did you eat for breakfast today?
Okay.
Okay.
Well, for breakfast, well, as usual, I always drink a big cup of orange juice and then some cakes, and that's all.
Everybody should practice speaking.
Okay, I always take a cup of tea and some biscuits, and after that I can go to my work.
Hmm. Okay, I've
Well,
heard you using the term biscuits. Is it very common in the USA, doctor?
But I'm not in this. I'm trying to
cookies.
concentrate on something else. Pause. Yeah,
Okay.
You in US, I think it's
Cookies,
in USA's cracks, cracks or
cookies. It's like cookies in USA.
Yeah, cookies is more used than
Biscuits.
biscuits.
Okay.
Yeah, but it's always okay. Okay, what about you?
yes,
Sarah,
yes,
you
my breakfast was an omelette and a cup of tea.
okay? Very nice. What about you?
Yeah,
What do you
it's a,
usually have on breakfast?
yes. My breakfast was a sandwich with cheese, I think.
Okay.
Yes,
Cheese sandwich,
actually,
yes.
I
Yes,
prepared
cheese
it.
sandwich.
I didn't prepare it, so he went to his work without breakfast
Oh,
actually because I woke up late.
Yes, I have my breakfast from the street this morning.
yeah, it happens from time to time.
And you are happy, Shadi, by street breakfast, I know.
Without doubt.
Okay,
Well,
doctor, I can see the fire right now. Thanks. Thank you,
okay.
Sarah.
All right. All
You're
right.
welcome.
But I did 4 of them. I did 4 of them, and I can't find them. All right. So, do you see them? Do you both see them?
Yeah, right now, yeah.
You both see them. All right. So, Nara, or was it Nabila? Nabila, did you work with Haas yesterday, or was that Sarah?
No, it
Sorry?
was Nabila, doctor.
Who was it?
It was
Me.
Nabila said.
It was Nabila. Nabila,
Yeah.
do you remember the activity that you did with Haas yesterday?
Yeah, actually, it is the case about malignant melanoma. It is a lesion in her someone back, and also a case of ear pain.
Okay. Did you practice that afterwards?
No, actually, I don't have time to do this.
Okay. Haas, do you remember that situation?
Not really. Not a lot of
Okay.
details.
Okay. So, Nabila and Sarah,
Yes.
the fact that you come to me and you practice with me, you still need to practice on your own. You need to practice somehow on your own. You don't necessarily need anyone to practice with, although it seems like it's so boring. It doesn't seem that you're going to make any progress. This is Saturday will be week 3. We'll only have 1 more week to practice with me. And I'm thinking of everything that I can possibly do to help you. But if you don't practice on your own, it is very unlikely that you're going to get the best score, but I hope that you will do well. I'm not exactly sure how else I can help you, because I can only help you by seeing where your weaknesses are, and then I point your weaknesses out. If you're not practicing just talking, just for example, when I just said now, although I was actually looking for something, if you do not take advantage of every opportunity to practice talking about anything, you are still going to be encumbered with those ahs and ahs. They're not going to go away magically. And on the day of the exam, you're going to have the stress of the exam. You're going to have the stress of not really knowing what question you're going to get, which means that your score may not meet the expectation that I have for you, but it is going to be primarily because you can say that you don't have time. Whether you have time or whether you don't, I really want all of you to succeed. When Haas came to me, I could tell you that Haas studies all the time. He studies all the time. Every opportunity he gets, he practices. And I think he even practices when he doesn't even have time. What was it, like 3 o'clock in the morning? You came to something that I was offering? Like,
That's true, doctor. It was 2 a.m.
Like he should be in bed. Now I know he's younger, he's single, he doesn't have children, but something within me tells me who is really excited about what they're doing. Haas isn't doing this because he has to pass an exam. He just wants to just know so much more. And the amount of time that I spend on creating these activities for you, I want you to know that you're not going to get this type of service from anyone else. And this will be the last time that I would even do the type of work that I'm doing. But this was the first time that I had actually done group classes. So I wanted to make sure that I gave you what I promised. If I was doing this one-on-one, I'm going to extend this class. So you don't have to worry that, oh, she talked all about this and this doesn't help me. I just want you to understand that what I am doing, which is fine, I get this for one class. I get $72 for one class when I teach students. One class, not 4 weeks. But I had never done group classes before, so I wanted to see how to do it. I wanted to know how to do it. So even when I'm doing things now, like I can't find my files, I have created files. I have a file for Haas. I have a file for, not you, Sarah, but Astra, and Daria. I have their own files, but for you guys, I don't. So it's me that can't find my stuff, but I did create the files for you. And I came on one day for whoever was online because I was available, that you can just practice with me when I'm not really busy. Mm-hmm. But don't neglect your family for me, because this isn't something that you have to be here for. Okay, so the reason I asked, Haas, Nabila, try to remember what you were talking about when Haas had whatever, because Haas is the patient. He is going to be the outlier. He is going to be the devil's advocate. He is going to tell you that his toe hurts, but that is not what you're focusing on. You're focusing on the fact that he has diabetes, I think. And he wants to know if that diabetes is, is he going to die or whatever he asks. So go ahead and start that conversation.
Okay.
Sarah, just listen. Shady, I'm going to go to your, what number was it, Shady? I don't think that's going to work though. So Shady, why don't you just hang out for a while and I'll give you a separate lesson, because I kind of like need to focus on what they're doing. You can stay, and if you have time, can you come back in an hour, Shady?
Yes.
Okay, so why don't you come back in an hour and we'll have your class. It will just be your class. You guys can come and listen to Shady's class, but I want to make sure that you understand what you should be doing in your class. All right. All right, so Nabila and Haas, could you talk about that episode? Nabila, you will start. Hello, I'm Dr. Dawood. You may start.
I'm sorry for interruption. I am. Do you want me to leave the meeting and come back after 1 hour?
Yes, Or you can stay and just listen, but I won't be paying you any attention.
Okay, so I have to leave and I come back after 1 hour so I can practice with other group.
That is correct.
Okay, fine. Bye bye. Thank you.
Okay. All right.
Take care.
So,
Okay.
Nabila, you and Haas are talking.
Okay.
Okay, Nabila, the doctor always starts.
Yeah, Nabila is the doctor, and the doctor will always start.
Okay. I shared the card you can use to remember the case house if you want.
No, he doesn't. He doesn't need the card.
Okay.
He doesn't need the card.
Okay, thank you.
Okay. Hi. 1 minute. Okay. Hi. I am Dr. Dawood. I will be your physician for today. Nice to meet you.
Hey, Dr. Dawood. It's very nice to meet you too. My name is Hussein.
Hi, Mr. Hussein. As I understand from your chart, your chart that you had left ear pain. Can you tell me more about this?
Well, that's true, doctor. I hardly have been suffering with that pain for the last 3 days, and some of my friends recommended me to drink some paracetamol. I drank it, but it didn't give like a notable result. So I decided to go and see a doctor. Do you think this is a serious problem?
Okay, Mr. Host, I want to ask you more question about this pain so I can assess your condition more specific. Okay?
Okay, so
Okay.
so Nabila, do you hear those ahs that you're saying? There are too many of them. Try again. Ask him again without the ahs.
Okay. Okay, Mr. Hossa, I'm sorry to hear that you have this problem, but let me ask you more question about this to have a good idea about your disease.
Okay, again, Nabila, without the ahs. Without the ahs. Just slow down and say, Mr. Hassin, I understand that you have a problem with your ear. I didn't hear you even acknowledge that whatever his problem was. So you want to say, I understand you have a problem with your ear. Is that right? And then wait for him to respond. Ask him again.
Okay. As I understand from your chart, Mr. Hussein, that you have air pain. Sorry, I can't concentrate more. Okay, because I have a child with me right now. So
Oh
I'm sorry
yeah,
for this.
I can totally understand that.
Okay,
She has her
so
child next to
okay,
her.
so Sarah, while Nabila takes care of her daughter or son, which one do you have? It doesn't matter. Haas doesn't need to know what he's there for.
Okay. My case was you mean that the one of the assignment? That's
It,
right.
does, it doesn't matter.
Any,
Just
anyone?
it,
Okay.
it doesn't
Okay.
matter.
Okay. Let's take again the assignment one. Okay.
Okay, well
You mean
now what is assignment one? What is his problem? What is
And okay.
diabetes?
No, not diabetes. It was about 25 years old man with
Mhm.
white ulcers on his tongue.
Okay. So
Okay.
Haas, you are 25 years of age. You've got a problem with your mouth. When you speak, there's an ulcer, there's a sore in your mouth, and you have a job and that requires you to talk a lot. When you talk, your breath smells bad. You've taken some medicine, but it isn't working. You've had this problem for a very long time, but it just flared up. You got a new job, and this job is very stressful. Okay. You want
Doctor,
to
I
know,
want to ask you.
you want, so Haas, you have an appointment in 24 hours. So you need something to cure this in 24 hours. Okay.
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 I want to ask you a question first, doctor.
Yeah.
If or yesterday I was listening to a health report on Australian radio. So
Mhm.
the speakers was already have little about thinking, translating. So is
I didn't understand the what?
I mean that's natives. I yesterday I was listening to one of the professors talking about an issue. So he had one or two arms. Is that acceptable?
I still don't get you. I don't get your
I
question.
mean, 1 to 2 is it acceptable to have 1 to 2 It is about thinking, not related to translation.
I don't get the question. I don't understand the question.
Dr.
Sorry.
Priscilla, what I wanted to ask you that 1 or 2 it is not a big deal, or is that?
The ums and the ahs?
Yeah.
That's fine to have 1 or 2, but you are having more than 1 or 2. Yes,
Okay.
even when I speak, I say them.
Mhm.
Yes,
Yeah.
it's normal, but when you're saying it, I get the sense that you're translating a word in your head from Arabic maybe to English. So no, it's perfectly fine to have them.
Mhm.
Yeah.
Okay, let's count. I will try to
Okay.
minimize my eyes now. Okay.
Well, for now, I just want to see if you got the flow to make me feel empathy, to make sure that you're calling my name, to make sure that you understand what you're diagnosing me for and the treatment. Okay. So
Okay.
start again.
Mm-hmm.
Hello.
Hello, doctor.
Well, nice to meet you today.
Okay, so Sarah, remember when you come in, you have 5 minutes. So you want to say, hello, I'm Dr. Sarah.
Okay.
I am the attending physician for blah, blah, blah today.
Okay.
How are you?
Hello.
No.
Hello, doctor.
No, Sarah.
No, you should carry on.
Sarah, say, hello, I'm Dr.
Okay.
Sarah. I am the attending physician.
Okay.
Okay.
Hello, I'm Dr. Sarah. I'm the attending physician today. Nice to meet you. How can I help you today?
Hello, Dr. Sara. It's very nice to meet you too. My name is Hussein.
Welcome, Hussein. Yes.
Thank you. And I'm here for a serious problem. I've got some problems with my mouth smell, and I've noticed that I have some sort of ulcers on my tongue. And I work as a translator, and the bad smell that comes out from my mouth started to bother my clients. So is there some sort of medication that I need to take in order to get rid of this problem as soon as possible?
Cool.
Okay. I'm so sorry to hear that. It must be have been very embarrassing for you, But let me assure you that it is quite common condition. So you don't worry at all. But first, let me ask you some questions, if you don't mind.
Okay, so
sure.
Sarah, you haven't shown me empathy. You haven't said, I can understand you having this problem. Your breath smells bad. I probably wouldn't say that, but you're uncomfortable speaking with people, in front of people with this problem. This is showing empathy that you heard me before you start to tell me what I need to do. So, hello, I'm Dr. Priscilla. I will be the attending physician today. How are you?
I'm fine, Dr. Priscilla. Nice to meet you. My name is Hussein.
Hussein, could you spell that for me?
Well, that's Hosseine.
Okay, Hussein. Well, it's very nice to meet you. So tell me, I understand looking at your chart that you had something wrong with your mouth. Can you tell me a little bit about that?
That's true, doctor. I've been suffering from that problem for the last 1 year, and my spouse has noticed that. She told me that a bad smell started to go out from my mouth 1 year ago, and I started to notice some white ulcers on my tongue. So I'm wondering if this is a serious problem.
I think I understand. You see how I'm interrupting him because I want him to stop talking? So, okay, I see. So you've had this problem, and I'm just choosing one thing that he said. So you've had this problem for over a year?
Mm-hmm.
So have you had this? Okay, I understand. I understand that could be a problem. You see, I'm showing empathy. and then ask him something else that's on your chart. This is probably when you start to explain what he may have. Well, it could be, Mr. Hussein, that you have what is known as blah, 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 blah. It is a condition that can be easily treated with something, something, something. Then Haas, and then you say, do you understand? And Haas is going to say, no, I don't understand. My breath stink and I got whatever. And then you say, don't worry, Mr. Hussein. Looking at your chart, these are some of the things that we can do, blah, 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 blah. Got it?
Okay. Yes.
Okay, try again. Nabila?
Okay.
Nabila, are you here? Okay, go ahead. I'm still looking for my work because I created that work. Keep practicing. Go ahead, Sarah.
Okay. Hello, I'm Dr. Sara. I'm the attending physician today. Nice to meet you. How can I help you today?
Nice to meet you too, Dr. Sara. Well, I've got a serious problem with my mouth smell. My spouse has noticed that 1 year ago, and I work as a translator, and the clients start.
Interesting job. Yes, this is interesting job, by the way. Okay. So, could I know what's your name?
Well, my name is Hussein, doctor.
Okay. So, Hussein, if you don't mind, I would ask you a few further questions about your situation. It's okay with you?
I would like to ask you, if you don't mind, I'd like to ask you a few more questions. Sarah.
If you don't mind, I would like to ask you a few further questions. Is that okay with you?
Okay, sure, doctor.
Okay. Could you describe the pain you have, or could you tell me more about your condition?
Okay, well, I don't really have pain, but I've noticed that I have some sort of white spot on my tongue, and I'm wondering if this is a serious problem.
Okay, so do you have any increased frequency of urination or increase in frequency of drinking water?
What's that, doctor? Increase in frequency?
Yes, I'm asking about, do you have to go bathroom more frequently than before?
No, doctor.
Or drinking more frequently? Drinking water more
No,
frequently?
doctor. No,
Okay.
no, doctor.
Okay.
I'm the kind of person that likes to take care of his mouth cleanliness, and I'm wondering where this problem came from.
Okay. May I have a look at your mouth to have better idea? Okay, that's great. Okay, thanks for keeping or taking care of yourself and having good mouth hygiene habits. It's good for our health in general. So back to our discussion, our questions. I want to ask you one more question about if you have like fever.
I don't think so. I'm not suffering from fever.
If you have any abdominal pain or diarrhea.
Yes, doctor, from time to time.
Okay, it is related to stress, or it's could you describe when this actually did this start?
Okay, you mean the mouth problem, doctor?
Okay, I mean, it is. Have you noticed any relation between diarrhea and your mouth ulcers or mouth lesions?
No, doctor, but I've noticed that my eating habits has changed a little bit.
Okay, okay. Let me assure you that is quite common condition. There are many others have similar condition, so you don't have to worry at all. The good news is that there are many available options. Okay, and it's simple. You don't worry. You don't need to get alarmed with about. Okay, so what I want to tell you now that I would like to explain you what is the diagnosis, what the probable diagnosis. Okay, I believe, Hussein, that you have common condition called aphthous ulcers. This is known. This is a condition, idiopathic. Do you know what is abscess ulcer? Do you have any idea about them?
No, I don't think so. I've never been introduced to
Okay.
this term before.
So, keeping on, I will tell you this is abscess ulcers are common and they are self-limited. They are related. This is no specific reason for them, but it's related to our lifestyle. So we need to have healthy lifestyle, like getting rid of extra stress, and it may be related to your hormones changes, or it's simply caused by viral infection, for example. So what I want to tell you now, I want to highlight how to have a good um, mouth hygiene habits. What do you think about that?
Okay, well, I think in order to have a great mouth cleanliness, we need to clean our mouth after each meal. Is that right, doctor?
Yes, that's right.
Mm-hmm.
Okay, and this means that you almost washing your mouth 3 times per day. That's right.
That's right, doctor.
Okay, so let me add that you probably need to rinse your mouth with warm, salty water. You can use antiseptic gel. You can use an anti-inflammatory like paracetamol for the pain if you have.
Mm-hmm. Okay, doctor.
This okay.
Will this help me within 24 hours? You know, I've got a job interview tomorrow and I need to get rid from this problem as soon as possible.
Okay, that's a good question. I understand your feelings. So I will give you like a spray, mouth spray is very good. I will prescribe for you, by the way, and it is very good to resolve this temporary situation. Okay,
Okay,
and
doctor.
okay, but I strongly recommend to you to get rid of stress by relaxing, by having doing exercise, and sharing concerns with friends. It's a good way to get rid of stress. Okay.
Oh, thank you,
Okay,
doctor.
so
Thanks for that tip.
let's stop there. You got the part. You understand the first part. You understand how I'm asking you to make him feel like you are listening to him. I think it took you a little bit too long to get to his remedy. Remember, although he did not give you anything to throw you off, you kind of went too long with stuff. Remember, you're going to be assessed on your ability to give him a diagnosis and a treatment plan. Okay? You
Okay,
understand?
you mean that's a diagnosis and treatment plan should take the most of time. That's right.
No, no, I don't know which one needs to take the most time. I just know that you need to be sure to give it to him. You can give it to him in incremental stages. You can tell him, if he tells you that he has already rinsed his mouth, then you don't need to remind him at the end. But there are certain things on your card that you do need to mention. And he said that he was already using something. But it is something that you need to practice with. But I think I found my activity. Nabila.
I'm okay right now.
Okay, so did you find an activity? I want you to find a brand new activity. Give me a brand new activity, Nabila. Tell me what number it is. We are going to do the one that you had, but I did find my files as well. Give me a brand new one, Nabila.
It's
Very
you
quickly.
mean the case of left
Yeah,
ear?
I'll give you one, Nabila. Yeah, I want you to go to
Anyone or you want specific one?
anyone. Just tell me which one, unless I find one first. Unless I find it first. I'll share it
Page
with you.
14.
No, find one way back, maybe 2022, 27.
Okay,
Something.
it's okay. 20.
I'm looking for the book. I know I'll find it. I'll find it. Haas, can you see my screen?
Not yet, doctor.
Okay. Yeah, let me see if I can share again.
So, which page, please?
I haven't found it yet. I was just making sure that I was sharing my screen. Do you see my screen now?
Yeah.
Yes.
Okay, so here's one. Haas, you're going to be, it's on page 27, Nabila.
Okay.
Haas, here's your diagnosis or your test. Nabila, you should have your book, okay?
Okay, yeah.
Okay.
Sarah, I want you to pay attention to the way that Nabila, hopefully if she establishes that initial introduction, hello,
Yeah.
just see if you can follow. Notice when she says his name, make sure that you can say the patient's name. Although I can't do it, I'm sure you're not going to have a difficult name. And if you have a difficult name, you can say, may I just call you madam or sir? People want their name pronounced correctly. Haas just allowed me to call him Haas because I struggle with his name. But you need to be able to pronounce the person's name. Okay, Sarah, Haas, have you read yours yet?
Yeah, I'm reading it, doctor.
Okay, Nabila, when you're ready, let me know.
Okay.
Doctor, what's a drug? DRUG.
Drug, a drug is something that you take, your medicine, you know, your pills, your prescription, the drugs.
Oh, okay.
Oh, and that's, well, and you know, some people who are addicted to drug like marijuana or I don't know, those other drugs that are dangerous. But in this case, it's just talking about medication. Also, Sarah, that word is a gourd, G-O-A-R-D.
Girl, yes.
I think that word is gourd. I wanted to tell you that word is gourd.
It's abbreviation for a gastroesophageal reflux disease.
Oh, okay. Well, okay. So you have any questions?
No, doctor.
Okay, and
What about the verb seize? Seize.
spell it.
Okay.
Last line, doctor. C-E-A-S-E.
Oh, I see.
Stop. It means stops, I think.
Oh,
Okay. Okay, stop.
okay.
And Parkinson disease is like what my mom had when she was losing her mental abilities. Like she couldn't remember things. That's what Parkinson disease is. It's
Yes. And it's about like rigidity in muscle and tremor. There is a frequent movement in hand.
Okay.
So this is main thing. Yes.
Okay. Are you ready?
Okay, we can start.
Yeah.
Okay, I'm gonna set the timer so that you may go a little over 5 minutes, but just be aware that it's 5 minutes. You may start when you're ready. Set timer for 5 minutes.
Okay, I'm ready. We can start.
The doctor always starts first.
Okay. Hi, Mr. Okay. Hi, Mr. Host. It's a good.
No. You don't know. You don't know who he is. You're saying, "Hello, I'm Dr. Dawood. I will be the attendant."
I prescribed for him before the drug.
Oh, you've seen him before. Okay.
Yeah.
Okay. So
Okay.
you would say, "Hello, Mr. Hussein. It's good to see you again."
Okay. Hello, Mr. Hussein. It's good to see you again. How are you so far?
Hello, Dr. David. It's good to see you too. I'm fine, thanks for asking. What about you?
I'm fine.
Okay. You know, doctor, I've been diagnosed with Parkinson's disease. And as I've already told you, I've been suffering from muscles rigidity and the Parkinson disease has caused stiffness and movement difficulties. And some drugs have been prescribed to me, and I really want to get rid of them. I don't really want to have drugs.
Okay, I see. I understand your concern, Mr. Hussein, but I recommend you to try
Okay,
to,
so Nabila,
yeah.
he has told you some things, and if you're going to start telling him what you recommend, you first have to let him know that you understood that he's concerned. So I understood you said that you blah 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 don't want to take drugs. Remember, tell him something that he's already told you so he knows that you're listening to him and not trying to rush off to the next patient. Okay, I'm gonna set the timer again.
Okay.
Also say, Nabila,
Okay.
when you find the moment, I don't want you to stop talking, Haas, but he's talking too long. He's taking up too much time to tell you stuff. So you need to interrupt him if possible.
Okay. Okay, Mr. House, I understand your concern.
No. You're starting from the very beginning.
Okay. Hi, Mr. House. It's good to see you again. How are you so far?
I'm fine. I'm fine. Thanks for asking, doctor. What about you?
I'm fine. Thank you. Did you take your medication?
Well, let's be honest. I've stopped taking them. I think they are not giving any results anymore. I don't think I can carry having those drugs anymore.
Okay, I understand your concern, Mr. Hussein. Right now you didn't take any medication for your condition, but I recommend you to try to take it because it will improve your.
Okay, so Nabila,
Hmm?
you've acknowledged that he doesn't want to take the medicine. Just say, is that right? You don't want to take the medicine, is that right?
I think this is it will take a lot time from me to to finish our task. I have 5 tasks, 6 tasks. I have to complete it. If I regain his what he say, it will take from my time.
Okay, well, I'm only suggesting that you mention one thing.
Uh-huh.
I'm only suggesting that you mention one thing that he says. Just say,
Okay.
I understand you because you want to build that empathy, and you got to build that empathy at the beginning, because
Okay, you are right.
later on you may have to make him stop talking, and then he's going to feel like, well, she's not even trying to hear me. I know that you have the 5 minutes. I understand what you're saying. Okay, so try again.
Okay, it's okay to tell him I understand what you said, but I recommend like this.
Well,
Other than repeat what he said.
Well, okay, so Haas, I'm Dr. Priscilla. It's good to see you again.
Good to see you too, doctor.
So looking at your file, you're here today because, what are you here for today?
Well, honestly, I've stopped taking those drugs, doctor, for Parkinson 3 days ago, and I'm wondering if this is dangerous for me.
So you're saying that you've stopped taking the medicine?
That's true, doctor.
Okay, so Mr. Haas, the fact that you've stopped taking the medicine, I have a real concern. The reason that you take the medicine is, and that's where you start whatever, you want to acknowledge that he has stopped doing something, or he's concerned that the medicine isn't working. I just picked one thing. It doesn't matter which one you choose, but you're acknowledging that I hear you, Haas, but I got some other stuff that I need to tell you. Okay?
Okay.
You want to try again?
Okay. Hi, Mr. Host. It's nice to see you again. How are you so far?
It's very nice to see you too, doctor. I'm fine, thanks for asking.
Are you taking your medication regularly?
Well, honestly, I've stopped taking them, doctor. I don't think they are giving any results anymore.
Okay, I understand what you said, but as I know, you recently diagnosed with Parkinson's disease. Did you know?
Haas, did she say that she knew that you stopped taking the medicine?
No.
No. You did not acknowledge. You did not
I
acknowledge.
understand what he said. I told him I understand what you said. Okay, I will try to repeat what he said. Okay.
And it doesn't mean that what I'm saying is the best way. I'm just
Uh-huh.
trying to. But you have. I think there's like 100 choices of whatever the doctor, whatever the examiner is going to give you. I want you to learn a systematic pattern that no matter what the patient has, these are the things that you're going to do. You will
Okay.
always ask the patient their name. You will always repeat that the patient has said that this is their problem. You're going to say, I understand. Then you're going to talk about something. And if the patient gives you resistance, then you're going to say, I understand, Haas. But whatever, you need to get back to where you are. Okay.
Okay.
Okay. This will be the
Okay.
last time we
Okay.
start over. Okay. Start again.
Okay. 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 Hi, Mr. Hussein. It's nice to see you again. How are you so far?
It's nice to see you too, doctor. I'm fine, thanks for asking. What about you?
Yeah, from your chart, you recently diagnosed with Parkinson's disease, and you should be right now on the drug called DOPA. Are you taking it regularly?
Well, honestly, I've stopped taking those drugs you're talking about 3 days since 3 days, and I'm wondering if this is dangerous to my health.
Okay, okay, Mr. Hussein, I understand your concern that you are not taking your medication regularly. But let me explain for you. It's a good thing to try to take your medication regularly because it will improve your prognosis and also decrease the progression of your condition. Have you do you have any idea about your diagnosis Parkinson's disease?
Well, honestly, I have no idea about that. I don't really understand why is it so important to
Okay,
take those drugs.
okay, let me explain for you. Actually, the Parkinson's disease, it is a degenerative disorder for central nervous system. Central nervous system means your brain. Okay, and it will affect your motor skills like movement of arm and leg, and also affect your speech and other functions. Did you have
Okay,
any
okay.
idea about the causes of this?
Well, up until the time I saw you, I had never been introduced to this, and I'm wondering what the Parkinson disease is. I still didn't get the meaning of this sickness.
Okay, let me explain for you again. Parkinson's disease, it is affect your brain. Maybe there are a lot of causes for this. Maybe due to head trauma or exposure to some toxins, or maybe simply unknown cause, right? And also we have approach for treatment for this disease. Okay, we can give you physiotherapy. It will help you also to movement to improve your movement and initiating gait and decrease your pain and improve your breathing also. But also we can't depend on completely on the physiotherapy. We need to complete the drugs you have to take right now. So I recommend you to try to take your medication regularly because this will improve your prognosis and decrease the progression of your disease. Are you following me?
Yes, I do. Yeah. Well,
Yes.
doctor, I've been told that I will be like amnesic. I will forget about my name if I don't take those drugs. Is that real?
Yeah, yeah, it will happen if you don't take your drugs regularly. So I recommend you to try to take it regularly. It will help.
Okay, that's pretty much convincing. And are there some other alternatives for the drugs?
Yeah, there are other alternative, but it will not no, it will not give you the chance to not to take any medication. The alternative will help with the medication, not to take this alternative instead of the medication. Like physiotherapy,
Oh,
it will improve your movement and also improve your gait and decrease the pain also. But it will not, instead of the medication, you have to take both the medication first and physiotherapy. It will help also.
Okay, okay, I see. And for how long time should I take that treatment?
Actually, the Parkinsonism disease, it is a lifelong disease. You will take this medication for the lifelong.
Oh, that's a little
I'm
disappointing
sorry
for me.
for that. I understand it's so difficult for you. But if you take the treatment regularly, your condition will be improved.
Oh, okay, doctor. Thanks for those sympathetic words. I really appreciate you.
Yeah, thanks.
And yeah,
Do you
so
have
thank you, doctor.
any more questions?
Well, I don't really have any other questions.
Okay, Mr. Hussein, it's good to see you today, and I look forward to seeing you at your next appointment. Bye
Thank
bye.
you, doctor. It was good to see you too.
Okay,
Okay,
bye.
just a little more practice. How many times did you hear your name, Haas?
Um, like 2 or 3 times
Three. Yeah.
only.
I heard it twice, and then at the very last when she said thanks for coming in or something. So again, it's important that you, I don't know how many times is enough or how many times is fewer, but there would be times when he said something that, Haas, I can assure you that you will be fine if you take your medication. So are you understanding what I'm explaining about whatever the disease is? Wait for him to say, yes, I am. Yes, I do. And all you're looking for is a yes, I do. And if he starts on with a lot of unnecessary stuff, you need to bring it back. Well, let me bring you back to why you're here today. Okay, I found my screen. Just know that, just watch. And I will tell you all that if you're making notes, if you're sending me notes, I see now the big orange sign that maybe there's something that I'm supposed to read, but I'm not really reading anything. Because I can't find stuff over here, but 3, I don't even see my chat, but it looks like there's something in the chat for me, but I can't even find the chat. All right, I'm going to go to share my screen. Sarah, are you understanding what I want you to do now a little clearer? Is it a little clearer?
Yes. Let me summarize if I can.
Sure, go
I
ahead.
think you want to focus on that the beginning. It's the gold mark because we can make a good communication or rapport between the patient. They start build up a relationship with the patient by empathy, by mentioning his name, and understand what actually he had. Then we can go through the others, but not forgetting the repeating his name.
That's correct. Because when you hear your name, Sarah or Nabil or Haas, it makes you, or me, when I hear somebody call my name, I'm going to pay attention. I'm going to know that they're talking to me, and I feel like they hear me, they see me. Okay? So that's what we want to make sure. We want to establish that at the very beginning. All right, let's see if we're still recording. All right, so here's my sheet. I'll just post these in the Facebook group. Yes, but for now, they're not there because it may take me too much time. So this is the patient that had the pain in the ear. I don't know whose was this or what's the
No,
one that I
that's
created.
the horse palpitation, doctor.
Okay, well, this is going to be the conversation. Was Nabila, can you be,
Okay.
now, Nabila, it is up to you to know more about what I have not put in this because I don't know about these. I don't know the genre of the medicine that you are going to be tested on. You know, you need to tell me something that Priscilla wouldn't know. When you're talking to Haas, you need to know something. Haas, I want you to get off task. I want you to put something in there so that it encourages her to come back to this conversation. Do you understand?
Mm-hmm.
All right. So I'm going to set it for 5 minutes. If you don't take 5 minutes, don't worry about it. If you take a little bit longer, I will stop you.
Okay.
All right. When you're ready, the doctor always goes first. Remember that you are probably going to go first in the exam.
Okay.
Set timer for 5 minutes. You may start.
Hi, I am Dr. Dawood. I will be your physician for today. Nice to meet you.
Nice to meet you too, Dr. Dawood.
Okay. How would you like me to address you?
Okay, doctor. I've been suffering during the last few days from a heart palpitation, and I'm really anxious about that.
Yeah, okay. So first, how would you like me to address you?
Sorry,
First,
your
how would
voice
you like
is
how
breaking.
would you like me to address you?
Your name. Your name. What is your name?
Okay, okay.
Sorry.
Okay, I will. Okay, can you hear me?
Oh yeah, I can. Yeah, yeah, yeah.
Okay. Okay, how could me how would you like me to address you?
Oh, you can call me Hussein.
Okay, okay, Mr. Hussein, as I understand from your chart, you came here because you are been suffering from palpitation. Is that
That's true,
correct?
doctor.
No,
That's true,
this is,
doctor.
are you not seeing the one on the screen? It's the pain in his ear.
No,
He changed the
doctor,
case.
we see something else.
Oh, well, let me put the one that I'm looking at. Okay, because I found my files. Now, do you see the pain in
So,
your?
yeah.
Okay, start again.
Okay. Hi, I am Dr. Dawood. I will be your physician for today. Nice to meet you.
It's very nice to meet you too, Dr. Dawood. I am
Okay.
Hussein.
Okay, Mr. Hussein, as I understand from your chart, you have been suffering from left ear pain. Can you tell me more about this?
Well, doctor, I've been suffering from that pain for the last 5 days, and I've noticed that some sort of pus was going out from my ear too. I mean, the left ear. Is that really dangerous?
Okay, I understand your concern. You told me that you had a left ear pain, and also you notice some amount of the pus coming out from your ear. Can you tell me more about this pus? Is the amount large or small?
Yeah, the amount is not very big, and the color is a little yellowish.
Okay, is there any blood in it?
No, there is no blood in it.
Okay, Mr. Hussein. According to the information you're giving me, you most probably have some kind of ear infection, maybe called otitis media. Have you heard about this before?
I don't think so. I've never been introduced to that before.
Okay. Let me explain for you what this. It's a kind otitis media. It's a kind of infection of the middle ear. Sometimes lead to some pus formation, and this pus, when it is in large amount, it make a small hole in your eardrum. And after that, if the pus release, your pain it will be decreased. Are you following me, Mr. Hussein?
Yes, yes, I am.
Okay, that's good. And let me assure you, this is not a dangerous condition. You will take some medication like antibiotics and pain relief, and your condition will be relieved with the time.
Okay, thanks for reassuring me, doctor. Well, does that mean that I have a hole in my ear? What can I do in this case?
Okay, I understand your concern is that horrible for you because you don't have a good idea about this. But let me assure you, this whole will completely resolve on its own by using the antibiotics and the pain relief. Is that okay with you, Mr. Hussein?
Oh, okay, okay, doctor. Well, let me tell you something. My father is suffering from Parkinson disease.
Oh,
Is it caused by stress?
Okay, Mr. Hussein, I understand your concern about your father, but let me first discuss your condition. After that, if we have time, we can discuss your father condition.
Okay, okay, I'm fine with that.
Okay, Mr. Hussein, do you have any more question about your condition?
Okay, I've been taking the paracetamol for a long time, and I've been told that it's not useful in my case. Is that real?
Actually, paracetamol it will help to decrease your temperature, but brufen more better in your condition because it will decrease the inflammation also. Okay, are you okay
Okay,
with that?
okay. Yeah, yeah, yeah. Okay. Okay, I heard you saying inflammation, right?
Yeah, because you have some infection in your ear.
Okay, okay, I see.
Okay, do you have any more questions for me?
Well, I don't really have any other questions for you, but in case I have other questions, I will call you.
Okay, it's my pleasure to help you anytime. Please call me anytime if you want, and it's nice to see you again.
Thank
Bye
you,
bye.
doctor. That's very
Yeah,
kind of you.
thanks. Bye.
Okay. So right now I don't know what they will tell you if you finish. So if the examiner has not said your time is up, you can say to the patient. So let me just review what we've talked about. We're going
Mhm.
to get a prescription for blah 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 for your ear. You should have some relief within a few days. And if you have any concerns, you can always call the office. Do you understand? And by this time, you will have a clock. I'm sure that you'll be able to see what you can say. Okay.
Mhm.
Okay.
But that was much better. I still heard a lot of Oz. I want you to, as you listen, I could have used my clicker, but I think that that would have been a distraction for you. So
Mhm.
Sarah, Haas, are you getting tired? Are you okay to do another?
Yeah, that's fine,
Okay, the
doctor.
same case.
No, no, it's not going to be the same. But remember, the format is the same. Establish,
Okay.
rapport, paraphrase, talk about what the symptoms are, make sure that there's understanding. Don't tell him too much because he's not going to remember it anyway, and I would not remember it anyway. And Haas, you can have a distraction in there as well
Mhm.
as you did before. Okay, so the next
Okay.
one is going to be
So I am an old man. I have some heart palpitations, and I
oh, I
have
don't,
ear pain and
you know,
Parkinson, and
yeah, yeah, you're just falling apart. You're just falling apart, Haas. Let's see if I can find the next.
You can one day become medical interpreters,
Yeah,
interpreter, you know?
yeah, yeah,
exactly.
yeah, yeah.
Okay. All right. So this one is, um, I forget what this one. This is the lawyer, I think. Yeah, this is the lawyer. Your life is filled with stress, and we'll just go through it anyway.
Okay.
Nabila, Sarah, are you ready?
Okay. May I have a look to the chart the screen you shared, or prefer you
Oh,
prefer
you don't,
to?
okay. You don't see my screen. It's a suburban.
No,
Oh, yes, I
he
can
has
see your
already shared
screen.
the screen. Yeah.
Okay, that's all you need because you should know the other information. You're just going to make it up. Okay.
Okay, okay. Hello, I'm Dr. Sarah. I'm the attending physician today. How are you?
I'm fine, thanks, Dr. Sarah. Thanks for asking.
Of course. Okay, what's your name? What's your name?
Well, my name is Hussein, doctor.
Nice to meet you, Hussein. Could you pronounce your name for me?
Well, that's Hussein, Hossinne.
Well, Mr. Hussein, from by reviewing your chart, I noticed that you have you are a lawyer. That's right.
That's correct, doctor. I am a lawyer.
Oh, okay. Very stressful work. I know. That's right.
Yes, that is correct. It's a very stressful work.
Okay, I can see. I have one relative who is a lawyer, and he almost all the day working. So, Mr. Hussein, could you tell me how can I help you today?
Yes, doctor. A few days ago, I've started that I have some sort of very quick heart palpitation. It feels like my heart is pounding or beating irregularly for a few minutes at a time.
Oh, so sorry to hear that. Must be difficult for you. But let me assure you that because you are a lawyer, so you have a lot of stress, and this cause, I think this is the cause of your condition. But first, I want to ask you, Hussein, more about your condition. Could you tell me more about your condition? That when did when did this start?
Well, it started, as I told you, few days ago, and I receive a lot of people claiming from different kind of problems. You can't imagine the cases of clients that I have. I don't
Well,
know if this
I
job is.
can see.
Mhm.
Yes, Mr. Hussein. Okay, I want to, if you don't mind, I would like to ask you a few further questions. If you have any pain,
Oh yeah, I do have some pain in the left part of my heart.
okay, I can see. So sorry, I can understand while you are working and you are getting this pain. It was like unexpected. But I want to tell you that I need to know more about that. If this palpitation all the time or just come and get.
Well, it shows up from time to time. It's not really regular.
Okay. Well, so Mr. Hussein, I will ask you a few another questions related to your lifestyle. How many cup of tea or coffee do you drink by the day?
Well, I drink about 2 cups of tea, one in the morning and one in the afternoon. But doctor, I've just remembered that my daughter has a problem with her mouth. She has some sort of ulcers on her tongue. Is that a serious problem?
You asking about your case or about one other?
Yeah, that's my daughter's case.
Your daughter?
Yeah, this is another case, doctor. I would like to
Okay.
have more
Okay.
clarifications, please.
Well, I can help, sure. I can give you um, primary the idea about that, but I want to see here if you have a chance to bring here, I can examine here. But actually, the most common cause of lesions in her mouth, it was related to a condition known as aphthous ulcer. So at the moment, I am not able to give you the right diagnosis. Okay,
Mm-hmm.
but back to your case,
Mm-hmm.
I want to tell you that you should have find the time to relieve your stress, and you will, if you follow my advice, you will feel much better because your palpitation will be decreased markedly.
Mm-hmm. Thank you, doctor. But I hope it doesn't require me to eat healthy food only. I'm very into junk food.
Mm. Yes, junk food, it's one of the causes that cause you that it makes you more liable to heart disease. But in your case, I think we need to run more blood tests or and ECG. It is like
Okay,
graphic
Sarah.
presentation. Yes.
Sarah, let's stop
Mhm.
there. Sarah, do you recognize anything that you did really, really wrong?
No,
Yeah,
I don't.
Nabila, do
you've
you
taken too
recognize
much time.
Haas? No, but Haas, Nabila, what did she do that was really, really wrong?
Yeah, when Hos asked her about her the sister condition, she started to talk about it.
Yes, you don't talk about anyone's condition except Haas. This is why you have to take control of the situation and say, be empathetic. I understand your concern about your sister, your daughter, or whatever, but let's concern ourselves with you today, Haas. And if we have time, we'll talk about your daughter. Because when you started to talk about that other thing, now he's got more stress. You're telling him that not only is he dying or he's sick, but whatever, whatever, whatever. So you don't want to be distracted. You have to recognize when there is a distraction. And it may not even be a distraction as such as it is asking about someone else, but when he's talking too long to explain something, you only have X number of minutes to talk and you need to bring it back. There were lots of times when I wasn't convinced, Sarah, and there are lots of good things, but I don't want to just tell you the good things because it's the things that you do wrong that you need to be aware of. So just know that even if I'm pointing out the things that you didn't do well, that it is only because of, for the sake of time, that I don't want to spend too much time on what you did so well right now, but what you didn't do, that I want you to work on those things. When
I
you,
need to check them later. I didn't. I didn't take note. I didn't care about the red point. So maybe I will take. I will review them later.
well, and it's okay. It's okay that you didn't follow the red point. The red dot really was for Haas. I was trying to get him because what is in your head is what you should know about the medical field. You should know how you should respond. But when he asked you something, sometimes I was confused as to what he should even say as a patient. Like, did he really understand what you said? And sometimes I didn't, because when you said, I want to assure you, Haas, about your ECG and the physical exam, that they show normal. That would have been a good time for you to say something about if it's showing normal, you can see that you're not at risk. But again, I can say that you didn't know what your card was supposedly about. So that may have
Well,
been,
doctor, can I say something?
yeah.
Okay. Well, doctor, since I will be leaving in a few seconds, I
Okay.
just want to congratulate them both for the great work they were doing, and I noticed that it's a little hard to combine avoiding the R's and the M's and thinking about the diagnosis at the same time. So I think this is the reason they keep repeating the R's and the R's, thinking and translating at the same time. So
Do you
I
have a
think
suggestion?
practicing. This is the
Yeah.
suggestion. They need to
Okay.
practice a lot. Yeah,
So we will
practicing is the
need you
key.
more.
Yeah, I will always be here for you.
Okay.
Thank you so much.
Okay, so doctor, it's time for me to leave.
Okay. I appreciate you. Thank you so much, Haas. Thank you so much. Have a nice evening.
You're more
Thank
than
you so much,
welcome.
Hos.
Okay.
Take care.
Thanks. Bye.
Bye-bye.
Bye.
Bye.
So the next one that we're going to look at, let me find the next one. And Sarah, we'll do the next one together. And Shady should be coming in pretty soon.
Lena.
So we've done this one. I'll delete that one. See, we did the patient in the ear. And Dr. Payne. What is this one? Okay, so this is the one with the blood pressure, I guess. I hope.
Okay.
Even if we've done it before, we'll do it again. Okay, so I'm going to share my screen. Do you see this one, Sarah? Travel plans with high blood pressure?
Yeah, we can see right now, but we didn't do this before.
I know. These were some of the ones that I just created. But again, they are still all the same. So for example, if someone has high blood pressure, and we did blood pressure the other day, I think. But whether we did or whether we didn't, there are certain things, Sarah and Nabila, that you are supposed to know. Do you understand?
Yeah.
Okay.
What is that?
Yeah, you should know what the treatment should be. You should know what I can do to reduce my high blood pressure. So you know what you know in the medical field. I don't know. You just need to make me feel like I'm not going to die. All right, so Sarah, I'm going to set the timer for 5 minutes.
Is there is any is this case we have the card in our book, or this is from your mind?
No, it's in the book, but you don't need the book. Just you don't need the book. I don't think. Okay, go ahead, Sarah.
Well, Dr. Priscilla, we should follow this part or from our minds.
Yeah, follow this part until you see some blah 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 blah.
Okay. I will start.
You may start, Sarah.
Hello, I am Dr. Sara. I will be the attending physician today. It's very nice to meet you.
It's nice to meet you too. I'm Priscilla.
Thank you for coming in today. Priscilla, did I pronounce your name correctly?
Yes, Priscilla is correct.
Okay, I'm taking a look at your chart and I see that you are here today for a general checkup. Is that right?
Yes, I'll be traveling overseas in a few weeks, and a general checkup is required before travel.
Okay, I can see that. Are you traveling for business or trip?
I'm going to go on vacation.
Okay, that's cool. Okay, so you need this checkup for so you can be able to travel. That's right?
That is correct. I'll be going on vacation because I'm so stressed on my job.
Oh, I'm so sorry. It's a good chance, by the way. So yes, I can understand your stress, but could you tell me more? Uh, um, I hope you have a nice vacation. It's good for the mind and the body.
I'm sure my health is pretty good. I'm only here because the insurance company said I had to come. What are we going to do today?
I want to start out first by congratulating you on going on vacation. I'm sure you will have a good time. Have you ever been diagnosed with as having high blood pressure?
No. Why do you ask, doctor?
I want to assure you that everything is probably fine, Priscilla. However, your blood pressure is extremely high today.
My blood pressure is high? That's impossible.
Let me share this with you, Mrs. Priscilla. You don't need to be alarmed. Today's reading is the first one and is required by insurance company. We want to be absolutely certain you are well enough to travel a long distance safely.
I know I'm fine. I'm very active and I'm definitely not overweight. I don't even smoke. There's no way I'm not going on this vacation.
I understand, Priscilla. However, there are a few things we need to check before you travel.
What are you saying? I was fine before I came in here. Knowing that I'm sick isn't going to help me relax.
I understand your point, Priscilla. I would like to arrange further tests outside the office, such as ECG, cholesterol, and urine analysis as an extra precaution. What is showing up today may be easily treatable.
Am I really sick? What's an ECG?
Your body is going through some changes at the moment, Priscilla. However, from what I can observe today, and your overall health, it appears that you will be fine.
What's an ECG?
Okay, ECG, it is an graph of your, it is a gram for electric activity of your heart. So we can check your pulse rate, the rate of your beats, and the rhythm of your beats, and checking any abnormalities like the straight if it is strong or weak.
Okay.
So
So why can't you just give me an okay to travel right now?
I wish I could, Priscilla, but your health is more important to me as your as your physician. If your symptoms are caused by an underlying problem such as renal or endocrine disease, you could be at risk for heart disease or other major diseases critical for life.
You found all this out with an office visit?
Today's visit shows that you have high blood pressure. My goal today, Priscilla, is to find the cause and generate a plan of care.
Can you give me a prescription just to reduce my blood pressure?
It is not that simple. Today was a single reading and more tests are required.
What about my trip?
Don't worry, Priscilla, at all. I will schedule your test for tomorrow and we should have your results in a few days.
What happens if the results are not good? Will I be able to travel?
I'm sure you will be able to travel regardless of the outcome. There are medication plans that can be created for you to follow while on vacation. Do you have any other questions?
No, thank you.
Thank you for coming in. It was good time to see you today.
Okay, so what your part was to explain to me that I just came into the office. I wasn't sick, but the insurance company said that I needed to have an okay before I could go on my vacation. When you took my blood pressure, it just showed that my blood pressure was high. And I was like, what? But you would not give me an okay to go on my vacation until maybe I just need to come in for another visit. And then everything could be fine. Okay, so I'll find the card. Okay, Nabila, let's do the same. We'll do the same, the very same one.
Okay.
And when I asked you what was an ECG, I didn't get the feeling, Sarah, that you really knew what an ECG was very quickly without reading it. I'm sure you know what it is, but your response wasn't fluid.
Yeah, a lot of things.
Okay. All right. 5 minutes, but it was scheduled for 5 minutes. If you had explained that easily, we would have done this within 5 minutes, I think. Okay. Nabila, you may start. Your 5 minutes starts now.
Okay. Hi, I am Dr. Dawood. I will be your attending physician today. It's very nice to meet you.
It's nice to meet you too, Dr. Daoud. I'm Priscilla.
Yeah, thank you for coming in today, Miss Priscilla. Did I pronounce your name correctly?
Yes, Priscilla is correct.
Okay. As I understand from your chart, I see that you are here today for a general checkup. Is that right?
Yes, I'll be traveling overseas in a few weeks, and a general checkup is required before travel.
Yeah, that's amazing plan for you to travel overseas in a few weeks. That's good. Okay. So you will travel next week. Is that all right?
Well, it's not next week, it's 2 weeks, and I really need this chance to get away on
Okay.
holiday. I'm so stressed on my job.
Yeah, it's a good idea to get a vacation after stress days in your work. Okay, Miss Priscilla, I can understand that, and I hope you to enjoy your vacation.
I'm
Okay.
sure, I'm sure I will, and I know my health is good. What are we going to do today?
Okay, I want to start out first by congratulating you on going on vacation. I'm sure you will have a good time.
Well,
Okay.
I certainly hope so.
Okay. Okay. Have you ever been diagnosed as having high blood pressure?
No, why do you ask?
I want to assure you that everything is fine. However, your blood pressure is extremely high today.
What? My blood pressure is high? That's impossible.
Okay, I understand your concern that this your first time that your blood pressure become high. But let me share this with you, Mrs. Priscilla. You don't need to be alarmed. Today reading is the first one, and is required by an insurance company. But we want to be absolutely certain that you are well enough to travel a long distance safely.
I know I'm fine. I'm very active and I'm definitely not overweight. I don't even smoke. So there's no way I'm not going on this vacation.
I understand that you are very active and not overweight. However, there are a few things we need to check before you travel.
What are you saying? I was fine before I came in here. Knowing that I'm sick isn't going to help me relax.
I understand your point that this is the first your blood pressure become high, but I would like to arrange further tests outside the office, such as ECG, cholesterol, urine analysis, and extra. What is showing up today may be easily treatable. Don't worry.
Am I really sick? What's an ECG?
ECG, it is one of the imaging study for your heart to give us how it's work well or not.
Mm. So you can approve my traveling without a problem, right?
I think I will give, and we will do some tests first. After that, we can decide.
You found out that I had some problems just from one office visit.
Um, Today visit shows that you have high blood pressure, but my goal today is to find the cause and generate the plan of your care.
Can you just give me a prescription to reduce my blood pressure?
I understand that you're concerned, but it's not that simple. We need to know what is the cause for that. So we need to do some tests. After that, we can decide what is the cause for this high blood pressure today.
What about my trip?
Don't worry, I will schedule your test for tomorrow, and should have your result in few days.
What happens if the results are not good? Will I be able to travel?
I am sure you will be able to travel regardless of the outcome. There are medication plans that can be created for you to follow while on vacation. Do you have any other questions for me?
No. Thank you for your time.
Thank you for coming in. It was good to see you today.
Okay. So we had 3 seconds remaining. Okay. So that was good. A lot of empathy. A lot of empathy was shown. You knew I was going to go on vacation. You were happy that I'm going to go on vacation. You assured me that I will be able to go on my vacation, even if I have to take medicine with me. So there's a difference that you told me what the ECG was, even though I still don't know what it is, but you told me what it was. You answered my question, and that lets the examiner know that you know what an ECG is as well. That's what they are looking at to see if you know what some of the stuff is that you are supposed to know as a medical profession. Okay. I don't know where Shady is by now. Any
Okay, I think he was on call, so I will check him now.
Okay. Any questions for me, Sarah, Nabila?
Yes, I do, doctor. I want.
You go get Shady first. Go get Shady, and then
Okay, okay.
Nabila, you have questions?
Yeah. Do you think, doctor, if we practice alone, I can get the more progression, or I need to study partner to improve
No,
my?
you don't need a study partner. I didn't need a study partner to do this dialogue. You can create dialogues yourself, and you can post them. And then when I have some free time, I'll go in and I'll read them, and then you can pretend that you're responding to whatever it is that I said. I think I did one, but I didn't post them. I mean, I can post them, but I don't want you to be overwhelmed by what I post, because when you see them, you think that you're supposed to do them.
Okay.
Which is when I did them, I should have posted them. That way I would have found them easily. but I said if I post them, you'll misunderstand what I want you to do.
Okay.
But it isn't necessary, really, Nabila, it isn't necessary for you to practice any more than the 4 or 5 that we've already done.
Okay.
They're all the same. If you know what I'm saying, all of them are going to establish rapport, no matter what the diagnosis is. If you understand the diagnosis, the scenario doesn't matter. I could say, for example, let's just create one. Let's just create one very quickly, Nabila. Hello, I'm Dr. whatever. Go ahead, Nabila, very quickly.
Right now?
Yeah.
Okay. Okay, I am Dr. Dawood. I will be your physician today. Nice to meet you.
It's nice to meet you too. I'm Priscilla.
Okay. Okay, Priscilla. As I understand from your chart, you're coming here because you have a problem in your bowel
No,
movement.
doctor, it was my left wrist. I broke my wrist. I broke my wrist and I can't use my hand.
Oh, I am sorry to hear that. It must be so difficult for you to handle everything without you using your hand. Okay,
Yes, it is. It is very difficult. I broke my hand yesterday.
yesterday, can you tell me more about this? What's happened?
Yes, I was helping my son build this dollhouse. I dropped the hammer and then I fell off the ladder and there I broke my wrist and it's just dangling. Should I be
Okay.
concerned? Will I have to cut my hand off?
No. I understand your concern about this, but let me assure you that we need first to do X-ray. It is some imaging study to see if there is any fracture or not, and after that we will make the decision for this.
Okay, you said images. Well, we took pictures of it. We took a picture with my camera.
No, not like this. I mean, we want to see the bone and if there is any fracture in your bone or not.
Oh, well, we're going skiing tomorrow. So will I be able to go skiing tomorrow?
Skin?
Skiing on the water, on the lake. Will I be able to go on the lake and swim?
No. I think this swimming it will not the best choice for you. We have to first do the X-ray to make sure if there is any fracture or not. But if there any fracture, I recommend you not to go for swimming. It will
Okay.
harm you, and yeah.
Okay. So you see how we establish rapport. I told you what my problem was. And because you don't have a card, and when you get into real life, you're not going to have a card.
Yeah.
But did you acknowledge that I like to swim? You could say, oh, I see you like to swim. But unfortunately, you won't be able to go swimming tomorrow, but we will take care of it. Okay. All right. What was your question, Sarah?
Okay, regarding to the samples or the way we done, what is the aim of that? I mean, what's the aim of this conversation or dialogue that we just have made?
Okay, so Sarah, I'm going to answer your question, but I'm going to see if Nabila can tell you.
Yeah. Okay. It will give you a template to what to should you say and how can say the conversation. You don't have to obligate to use this, but it will give idea to what you should say during the conversation.
That's correct. So what happens, Sarah, is that you have to do something with your brain. Your brain doesn't know what to do with like this or this or this. Your brain doesn't know, they just know that the brain sees something, but the brain doesn't know what to do with this. So my brain now knows that when I see a container like this, I know that it is not a glass for drinking water. Although I could drink water from it, but my brain knows that this most likely is a water bottle. Okay. So when you start to practice a dialogue, oh, your brain says, as soon as I see the patient, I should say, hello, I'm Dr. Sarah. Your brain then waits. What do I remember? I need to wait for the other person to speak. So every time we're practicing teaching our brain how to respond to something.
Okay, I can see what I found out now, that it's preferable to practice the samples with Nabila, for example, to post this dialogue, and next time we were able to simulate the samples.
Right.
Is that
Yes, exactly. So every time even when you're sitting for your exam, you will say, hello, I'm Dr. Sarah. I am the attending physician. You will, I mean, it may not be that, but whatever it is, you should be practicing the same thing over and over and over again. Even though you have a book that has so many examples, the format is the same. It's like cooking. You always cook rice in a pot. You do not cook rice in a bowl. You always get a pot. You always add water. There are some things that you always do. So the scenario is, instead of eating beans and chicken, you're going to have corn and beef. But the procedure is the same. You're still putting the ingredients in the pot. Okay?
okay?
So the more opportunities you get to practice a real structured dialogue, your brain can say, oh, I forgot to say, what is your name? But until you do it again and again and again, you will forget. And that's when those but you do need to know what an ECG is. You need to know why people have blood pressure. That isn't something that I can write because I don't know. But when you start to practice what you know as your discipline, you just know it. Okay.
Okay, that's clear. Okay, thanks, doctor.
Okay. So I want you to go back and those questions that I asked you to tell me about the task. I want you to tell me what is the procedure for knowing whatever it was. The ones I listened to earlier, and I said that wasn't quite what I was looking for. If your task is to tell me that I've got mucus in my mouth or something was wrong with my mouth, what did you diagnose this as and why? And what is the maintenance program? I don't need you to say, hello, I'm Dr. somebody. I'm only interested in how are you going to tell me the task? Do you understand?
Like the templates, like the templates we already practiced. We have.
Well, I don't necessarily know that we practiced the template. Let me look at one to show you. I have to go back to my book. I'm coming, Shady. I'm going to get to you.
I think it's, you can scroll up.
Okay,
Up.
I can go here. Now, I'm not going to be able to say it correctly, but this is what I'll be looking for you to tell me something like. Okay, so I'm only looking at the task. I want you to explain to the patient that you are reluctant to prescribe sleeping pills. Okay, so it would sound something like this. I really cannot prescribe sleeping pills for you right now because sleeping pills without knowing why you need the pills. It could be that you are anxious. It could be that you just need to change your eating habits. For example, I can provide you some self-care techniques such as exercise, suggesting that you eat more vegetables.
But Doctor, I think we just paraphrase them.
But no, the whole point for me is if I'm going to create a dialogue for you, I need to know what you need to know. I don't know what you need to know. So if you tell me what you are supposed to know, then I can put it in the dialogue. But I don't know what you need to know. This also gives you an opportunity to practice speaking. Even if you do it incorrectly, you can practice speaking. So tell me about this one, Sarah. What can you tell a patient?
Okay.
What could you tell a patient that can't get to sleep but wants some sleeping pills? What could you tell them, Sarah?
Okay. I will tell the patient. Hello, I'm Dr. Sara. I'm the treating
No.
physician.
I don't want
Okay.
I don't want that part.
So Priscilla, I want to tell you that if you aren't able to take enough sleeping hours, it will be a serious health problem. And however, the drug prescribing pills for insomnia aren't a good choice.
No, it's not even that. I want you to tell me. Okay, I want you to tell me something like this. I can't give you sleeping pills prescription because I don't know the cause of your not sleeping. Okay. And then it would be, so why? Refuse to move the patient that is.
Also, we can add the side effect of the drugs.
Yeah, you can tell me this, the side effect of the drugs might be whatever they may be. I don't know what they may be. So I'm just listening for you. I'm listening for you to speak. Also, my lack of being able to sleep can be the cause of not sleeping. Could be anxiety. And what are the causes of anxiety? I'm stressed at work, so I need to change something. But either way, just practice speaking. Just use it as an opportunity to practice speaking. I am going to comment on what you've already said. Okay?
Okay.
All right.
Okay.
We'll talk again. You guys can stay if you want, but I'll be working with Shady for about 45 minutes. Okay?
Well, thanks, doctor.
Okay, thanks, you
I
guys.
have to leave. Bye.
Okay, bye-bye. Thanks for coming.
Bye.
Appreciate
Okay.
it.
Bye.
Bye. Okay, Shady, are you there?
Yes, I'm here.
Okay, so rather than make this video so long, I'm going to hang up, save this one and post, and then Shady, I'm going to post yours. So everybody has to hang up, okay?
Okay.
But you all can come. It will be the same link. It will be the same link. Okay. Just give me like 2 minutes.